Would you back nurses going on strike? 0207 862 2222 is the number that you need. Now, the Royal College of Nursing is warning that they will consider strike action if the government doesn't boost nurses' pay. So, a survey of the union members showed that 91% do not think that 3.6% pay rise for nurses, as given this year, is enough. But it's not a bigger pay rise that they're asking for. They actually want ministers to reform the way the pay bands are working. Now, they say that workers are getting stuck on Band 5. Here it is. Band 5 is worth between £31,000 at the start and ends up to about £38,000 after 4 years of experience. So that's the band that actually quite a lot of nurses feel that they're stuck in. Now, the union want nurses to be automatically bumped up to this one. This is Band 6, and it's worth up to £46,000 after a certain period of time. Now, they're looking at about 18 months. And if it can be resolved, or if that can't be resolved, actually, if the government are saying, look, we're not going to put you up to this band, then they are threatening to strike. So this is the picture that we have at the moment. Dawn, what would you say? Would you support them striking?
Yes, I do, because I think they work incredibly hard. I think the offer that they have been made, I know terms and conditions apply, it's over so long, etc., etc., is insulting compared to what resident doctors have been offered. Look, Alexis, my dad was a union member, FOC of the chapel where he worked. I was brought up on picket lines in the 70s. I mean, long, hot summer, I was on a picket line. So I support everybody's right to strike. Mm-hmm. So, yes, I do support, the bottom line is I do support them, but I do also admit that it's going to have an awful impact on the NHS as it is at the moment, and we all know that it needs all the help it can get.
I'm surprised we're on different sides of this argument, because I would have thought it would be the other way round. I, like you, though, have enormous respect for nurses. Who, watching this show today, has not benefited from the care of nurses in our NHS over the course of their lifetime? But I just think that to go on strike again, when they went on strike a couple of years ago, for the first time in the history of the Royal College of Nursing, I don't think it's justified because of the impact it will have on patients up and down the country. Do I have sympathy and empathy for nurses? Yes, I do. Do I think that the model that we have for the way our country runs at the moment is working very well? No, I don't, because I think we have got a rock and a hard place. I don't think it's affordable to pay nurses more than what this independent body has advised and what the government has agreed. And I take the point they're not asking for more pay directly, but they want people to be on lower bands for less long. I get that. But you've got the affordability problem on the one hand, and on the other hand, you have got the reality that if you are a nurse, but also lots of other jobs as well, hospital porters and so forth, it is very difficult to make ends meet. So we are in a fix. I just think on this, I'm siding with patients marginally ahead of nurses, for whom I also have a lot of empathy.
43% of people in this country believe that NHS staff, doctors and nurses should not be allowed to strike legally. Would you go that far?
Well, it's a very
Police
good
and
question.
prison officers, I know, can't.
Police are not. So if the NHS...
Would you say that nurses and doctors also should not be allowed to strike?
I wouldn't go that far, but if we got to a point where the NHS completely ground to a halt and it was unable to fill in behind those who are striking, for example, when resident doctors, formerly junior doctors, go on strike, consultants will jump in and so forth. But if we
at
got
extortionate prices in some cases.
Yes, but if we got to a point where they were simply unable to provide emergency services, then I would change the law, yes.
OK, but we're in a position at the moment, and of course, since Trump came into the White House, where all of a sudden, the money that we spend on defence seems to, it's there, we have it, yeah, OK, we're going to spend it.
Well, we don't have it, we've changed the international aid budget as a consequence.
But it's being gathered in order to be spent on defence. For most people watching today, what do you think they care about most? That spending on defence, Dawn, or to getting the good care that they need in hospitals, where, let's not forget that quite a lot of these people, the junior doctors, the resident doctors, we should call them, and the nurses, when you speak to them, as I'm sure you have done, we all have done, one of their biggest frustrations is saying they cannot afford to give the service that the care that they want to give to their patients because they're being overworked and mismanaged and badly treated.
Yeah.
Isn't that more of a priority for people watching than the amount of money the government is able to find for defence?
If you ask people in this country, you do polls, consistently the NHS comes top of those polls. People want the NHS functioning properly.
So shouldn't we just be paying these people what they deserve to be paid?
I would love to pay nurses what they deserve to be paid. I think they're appallingly lowly paid, and I think this offer is an insult to nurses. And there is an issue here, and I know I keep going back to this issue about class. The majority of nurses are women. The majority of nurses are working class women. The majority of doctors are split between the sexes, but they're more middle class. So I think I'm more on the side of the nurses because A, they are very poorly paid in the first place, and the majority of them are working class women.
The problem is you're suggesting that we have to sort of take sides, and if we give the nurses a better deal, then what about the hospital porters? I mean, you talk about class. Hospital porters come from some of the most disadvantaged areas of our society. So where do you stop? That's the difficulty here.
Well, all right. As Alexis said, where's the money coming from?
Then you have to raise taxes, and if you raise taxes, the argument goes, well, then are you going to limit growth? These are really difficult considerations.
All right, let's find out what people are saying at home. Let's kick off with Shirley, who's in Hampshire. Shirley, welcome to the show. Would you support nurses if they chose to go on strike this autumn?
Well, I think they should go on strike if they're not being offered the same percentage as doctors. I think now in this country it should be equal offers on pay rises. None of this nonsense in the NHS about, oh, the doctors get more, the young doctors get a bit less, and then the nurses get, what's left. They should all get the same percentage of a pay rise.
OK, I don't want to upset nurses, and doctors have had that huge bumper pay rise. But do you think that it would be fair for doctors who have spent 7 or 8 years specialising, getting into their sections, they leave with an enormous amount of debt? Do you think having that equal pay would be fair for doctors?
Yeah, I do, because they're all on a different level, so the percentage.
So you're saying the percentage
really
by increase should be the same?
Different levels.
Fine. OK, got you. Fine. OK, Shirley, thanks for kicking us off. Alice is in Manchester. Alice, do you agree with Shirley that it should be across the board? And would you support nurses going on strike?
No, I would not.
OK.
My goodness, I've got a family full of a crop of consultants in my family, and I'm totally against what has happened with the doctor strike for a start. This is a vocation. Now, I come from an Indian background, and so I've always had an argument about this because, I often say that most of our people go into the profession not because they want to save lives, but for status reasons. But that's another argument.
Okay.
This is a vocation, and they should not be doing this. They are one of the best profession when it comes to when they get their pension deal is the best in the country for a start. And that's what you're talking about, they're on the lowest deal. Anyone would think that they're earning bloody 10,000. Sorry, I'm sorry, I shouldn't have said bloody.
That's all right. Thank you for apologising.
Beg your pardon. £10,000 a year. They're earning over 31,000. They're not exactly going out there with their begging bowl.
But hang on a minute, Alice. Alice, they're earning in proportion of inflation and what things cost. We've been talking about energy prices, the food prices. In proportion to that, their wages have stagnated. They haven't risen as much as the cost of living. So in real terms, they're actually earning less, if you like, than they were in 2008. I appreciate that for a lot of people it's a lot of money, but if your cost of living and your debts, let's not forget that doctors leave with, have risen, then
Alexis,
they're not being remunerated for what you say is a vocation, that even if it's a vocation, you still need to be paid for it.
Alexis, I don't care.
OK, you've made that clear.
Lives here. We're talking about people's lives here, OK? The word nurse, have people forgotten what that means? It's all about nursing.
OK, but Alice, I appreciate that you've got...
I'm sorry, I just, my family, like I said, they're not GPs. Most of them are consultants, and they always say, oh, my poor junior doctors. Listen, you've gone into the profession. Stop going on about what the pay is. The nurses that are going into the profession know what is expected of them. If they don't want to do it...
But then, Alice, if it carries on like this, then fewer and fewer people will go into that profession, and then you have a bigger problem on your hands.
Alexis,
Alice, I appreciate that you've got...
I'm sorry, I just, I think we're just assuming this. I mean, you know.
So you think that being a doctor or a nurse, you should do it out of the kindness of your heart?
You should do it. Yes, that's part of it. But the point is, there are other ways of doing this.
Okay.
You know, they could have quiet. They could have quiet demonstrations outside Downing Street. They could come to the public.
See how far that gets you getting your pay rise.
Well, I don't know. All I'm saying is this is a vocation. If you're going to go into it as a doctor or as a nurse, you should remember that you should never, ever, ever put the ordinary people or any person, a patient's life in danger. And that is what they're doing.
Alice, thank you. Thank you. You've made your feelings very clear, and thank you for that. Let's move on to Irene, who's in West Yorkshire. Irene, would you support nurses going on strike?
No, and I think that lady that's just spoken has spoken everything that I feel. I did 43 years. I would never have striked.
As a nurse, we should say, Irene, yeah? You were a nurse for 43 years.
43 years.
Yeah.
I loved the job. I love my patients. People come before any money, and I don't care. They do know what they are when they go into it. They do know that if they care for the people, that I feel that the universities have done an awful lot of this, because I think now they think they've been through university, they've paid all this, and they've got to. I know they've got all those things, but when people went into nursing in my day, you went in because you cared and you wanted to keep people well, and you didn't want to neglect people and leave them and stand on strike. But Irene,
and again, forgive me, I don't know when you were in nursing or not, but
I was from 1961 to 2004.
Right.
And I know that the wages now, and I know all the things that are going off. Sure. But if they can't live on over 30 odd, I mean, it's just ridiculous. The people that are trying to live on about 12,000 a year. Oh, you know, I mean, the human beings, and there's no money. The country's in a state. The health service is in a state, and the health service is in a state because people like this are letting it down. Okay. They are letting us down. They aren't in for that. They aren't in. There's a lot of lovely nurses. I'm not saying that. There's a lot of lovely, caring, loving nurses. But I do feel that at the moment there's an awful lot of them that have stood out on strike, and those that have stood out on strike to me aren't caring nurses.
All right, Irene, thank you. Thank you for your experience, and it's great to get your thoughts and Alice before as well. Thank you all for your calls on this. Look, later is going to be the papers and everything else, and find out why Microsoft is suggesting that you should become a sewage worker if you want to be having a job that is safe from AI.